It's true.
All right, Dr. Emer.
That golden retriever is in every movie. That same golden retriever. Are we live?
Yes, we are.
Hey guys, it's Dr. Emer in West Hollywood, and if you've been following Instagram today, we've been doing a lot of surgery, but now we get to the fun part, the real artistic, the subtle part. My birthday girl is here, she's beautiful, and we're gonna do a little what I call female facial sculpting, but this is gonna be for both immediate and long term. Her and I both have longer faces, a little bit hollowing in temple. We work out a lot. Look at these biceps. Unbelievable biceps. I'll tell you, they're better than mine, okay? They're better than mine, and I do lipo every day. She looks amazing.
And I haven't even worked out.
She didn't work out today. She has amazing biceps. So when you work out a lot, you get a little bit leaner in the face, especially not just with age, but also with exercise, because you metabolize a lot of the fat. So we want to build collagen over time, and some of the fillers can also metabolize with exercise. So you don't want to overdo fillers because they're going to look unnatural, but also you can metabolize them. So we're going to do a combination of fillers for fine lines, so it should look soft and natural, a little bit to help under eye, and then we're going to use Sculptra, which is a collagen builder. That's going to be used in her temple area and her just mid-face area, because she has beautiful jawline, beautiful cheekbone, and people start to notice a little bit of fine lines, so we're going to work to improve those. And then my long-term plan with her is this is a few times a year, and we start the laser process, the skin tightening process. She's beautiful inside and out, so we'll make her look that way. So we're going to start with the under eye, and what I'm going to do here for you so that we don't get a lot of bruising and swelling is we're going to do cannula injection. We're going to use Volbella, which I like in somebody that works out.
I actually felt that.
Well, you'll feel the first injection.
Okay.
Because that's the entrance site.
Okay, got it.
Then what happens after that, hold on, let me get that cannula in first. Okay, then you won't feel a lot, it'll be very little.
Okay.
And the key with that is we're gonna go right up there into the eye area, but right soft, because your skin's very thin. So we're gonna use a softer filler, this is Volbella. And the reason I like this filler for her, for two reasons. One is it's softer, and when someone's a little thinner, it looks way more natural, it won't look as puffy. But the second reason I like it is it lasts longer in people that are thin. So other fillers that kind of we put to the under eye, lateral cheek area typically only last 6 months to 9 months. It's not super long. The key here is also to do not just the under eye directly, but the lateral eye as well. So we're kind of going through this whole area, and you can see going all the way up there. I know it feels weird, I'm sorry. It's better than a needle. And less bruising, because we don't even see any right now. Okay, and you can see my cannula is right here under her eye area. Okay, and we're going to both the trough and what we call the infraocular fat pads, because that's going to give us support here to her under eye area. Perfect. And then what we're going to do is just kind of blend, and now it's already softer and better. So now hold right here lightly with your right hand, just for a sec. Just light. Perfect. And go to the opposite side. Or we do that same thing. Is anyone asking any questions?
Not at the moment.
And again, with the entrance, you'll feel a teeny bit. Little pinch, turn this way. 1, 2, 3, little pinch. Good, cause. Thank you. Take that for me. Perfect. Now we're going to do that same thing. She has really good skin, you guys. Really good collagen. So.
Retinue.
Yeah, I would tell you that I will say of all the things that exist for skincare, vitamin A and vitamin C, probably the two things that have been studied the most that show true effectiveness in anti-aging. Do me a favor, look up with your chin and to your right. There you go. Good. Just like that. Perfect. I'm doing real little threads, guys. Very little threads to give her support because she's very slim and athletic. You can see us here in the lateral part of the eye. People get a little hollow in the lateral part of their eye, so it's good to put sort of under eye filler there too. kind of soften the whole area.
How long does rubella last?
That's what we had just said, about a year. So the reason I like this for her is she works out and it doesn't metabolize as quickly. And with the Sculptra underneath, it'll help build and continue to give her support there for a longer period of time than most of the under eye fillers that only last about 6 to 9 months. Perfect. Okay, close your eye and hold it right there. Now we're gonna go towards doing the Bellatero for her sort of fine areas around the mouth. I like this filler. I like this filler. I'm gonna take that here. Keep holding on that side. I'll hit this side. But I like this filler for just this soft area around here. Kind of make that face like this. There we go.
Okay,
So you
just
can
make
see
sure that you kind of camouflage that fat thing.
I'm ready to do
God,
it.
God, I hate that thing.
We'll get it. But what reason I like this filler for her, she's slim. We just want to do slight improvement here. We don't want to make anything bulky, puffy. And with Bellatero, it literally goes in and just softens the folds and the lines really, really gently. When we start doing skin tightening for her too, a lot of this, and you can see here this lost volume here, we're going to start filling that in. You can see it. Little blebs here, guys. So with Bellatero, we do these little blebs. And some of the fine wrinkles above the mouth. I know this hurts a little, I'm sorry.
Is there something people should do or to prepare before getting fillers?
Not really. I always tell people don't use ibuprofen or any blood thinners like aspirin and stuff for a short time period if you can. And then what we do in Bellatero is we just mold that right into that surface and it blends into there. So now what I'm going to have her do is hold with this hand lightly right there. I'm going to take this down. Fingers free. And really what it is just you grab? I have them grab me for her birthday.
Can I please get a junior electrical number 5? Junior electrical number 5, please.
So, for prevention of bruising, you want to not use aspirin. Keep your skin clean. But it's very non-invasive. Smile again. Smile. Okay, relax. And again, Bellatero will look a little puffy today. So we're going more into the surface. It blebs up and then it fills in. It's the only filler that's considered a soft filler that integrates into the skin itself and becomes actually part of the skin, interestingly. So you can use it actually as mesotherapy to just plump the skin itself. We're using it here to kind of just hydrate. Little pinches above the lip, okay?
I have a question.
Yeah.
I have a little pock mark right there.
Yeah, we can get
Can
that.
you
Actually,
fill
you
that?
injected some of it already.
Oh, you
off
did?
the neck, yeah.
Oh, thanks.
Yeah, because I was doing fine lines all above here anyways.
That was from a laser that went wrong.
Oh no, do you know what kind? CO2?
No, it was the,
Oxal?
no. Keep
I
on
don't know.
going.
There's a lot, I have 80. It's hard
The
to know.
IPL.
Oh, an IPL, yeah, that can burn you sometimes. So, yeah, I'll go in there.
Somebody's asking if they can take osteoporosis drugs to avoid bone loss in the face.
Took a who?
Osteoporosis?
Oh, an osteoporosis drug? It doesn't affect the face.
Okay.
Hold right here now, firm. Now, since it's your birthday, I'm gonna throw in a syringe to do a little bit on the chin.
Oh my
Okay?
God. Thank you
it's
so
gonna-
much.
Because it's gonna help the volatero.
Oh my God.
I'm gonna do a little bit to give you a little more.
Mhm.
Okay, relax, that actually looks really good.
Mhm.
Okay, sorry about that. So what we're gonna do here is we're gonna give a little bit to give her some support. And this will blend everything that she's gonna do with the Sculptra. And this is always a game changer for people, love this. This also will give you a lot of support around your mouth. And I know this area bothered you, so it will really help. We're using a little Juvederm. There, good.
Dr. Emer, what other fillers do you like for the fine lines for someone with thicker skin?
Well, I'd have to see them because there's a lot of options. Things like Versa, Restylane, Silk. I don't know. We'd have to see, but in general, Bellatero is kind of my go-to for the fine wrinkles.
There's one thing on
Yeah.
my lip right here is on. Like,
Yeah. Do you want me to do a
Can
teeny
you,
bit?
can you just
yeah.
do that?
I can do
Just
right
to
at the
make it look,
border. Yeah.
make it look even, you know?
Sure.
if
Let
you
me see.
can.
Relax the best you can. Relax a second. Stay right there. I'm gonna do one little thing here.
People are saying happy birthday.
That's
Me too.
sweet. We're gonna do a little bit at this border
Mhm,
here,
mhm.
just to make it a little even. There you go. Why not? Now for her lip, want to keep it medial.
Mhm.
That's good. Actually, really good. All of this little puffiness will go down. So now the last part is, so we did a little, look at that, guys, even the quarter syringe and the lip, the Bellatero is starting to integrate. You can see how now it's blending, even though it looked a little puffy before, chin made a big difference. You're gonna love that. Now the last part is gonna look a little bit more puffy because we're using Sculptra. Now Sculptra goes through here and turn a little this way, and that does put a lot of fluid in. So this region right here is where we want to build for her long term. So we're going to start little struts, very in the fatty area of this face. We're going to do little teeny bits, and that's going to build some volume and some lifting for her over the course of the next few months. Well, it actually lasts longer than that, but it will start to build at that time period. Okay, so now I'm gonna have you to go ahead and hold on that side. There. Let's You'll do light massage there for her. And a little this way. So again, this little triangle right here is where we're gonna go, you guys. Just a little.
What about the puffiness or the inflammation? How long does it last?
Everything I tell people is 2 weeks, but it goes down faster than turning to the left. It goes down faster, but I always tell people wait 2 weeks until you worry about it, you know. She will look fine. Actually, she'll start to look even really good within a few days.
So this patient is wearing numbing cream, and
Yes.
we will also show the results in our Instagram page.
Yes. Okay. Take that one. Now we're gonna go up to the temple. I got you.
Okay.
She's gonna look all puffy and a little crazy right now. Now, hold this here. Good. So you see here now her temple. This is where she's really gonna have a value. We're gonna do two things. We're gonna go all the way to the deep temple. We do a little extraction here just to make sure. In this area, typically we are under. Hold on. We're actually under any of the blood vessels. It's clogged. Hold on. Give me another one. Give me another. So we do light massage, 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 you guys. She's not going to see all the results right now, but she actually look a little puffy right now, but okay. So now we're going to go back to where we were, right into that deeper part of the temple. We're going to start to fill that up. We're also going to reposition Okay, switch sides with you. Good. We're gonna go back to the opposite side. Yeah, go on that side. And this way now. We're gonna do that same thing. Deeper part of the temple. There we go. And I always tell people this area might hurt a little tomorrow when you chew because there's a muscle here for chewing. And we're going to go a little bit on the higher part of the temple. A little bit higher, right in here. We'll do that on the opposite side. Good. Pull right there. We're going to lightly massage. I always tell people sometimes the eyes feel a little bit numb even after this. But this is our long-term plan, you guys. This is going to help build a lot for her over time. And then lastly, final little bit of the Sculptra.
Yeah, the Sculptra lasts like 3 years.
Yeah, but sometimes are longer than that. You're going to turn this way. I'm going to do
This
a
one-
teeny
no,
bit.
no,
You're good right there. I'm going to do one little bit at
Okay.
the edge of the jaw, just a teeny bit. This will give tightening.
Okay,
And I always do a teeny bit at the lower edge down here as well.
okay.
And connecting to the chin where you have those fine
Oh,
wrinkles.
I was wondering, can you fill this in?
Yeah, I did.
Oh,
I did.
oh,
Yeah,
wow.
I did. I did.
You got
use it.
everything.
That's what I used the chin for.
Oh, wow.
That's what I did.
You're
How much,
amazing. He's
uh,
amazing.
He really is. How much Sculptra are you using?
I'm using 2 vials. And we're doing it all for foundational support.
Mhm.
Doing jawline, lateral, the mid-face area. Excuse me, and temple.
And I'll probably come in and get more on that because that does, you don't,
Well, that will
Well,
build a couple times,
mhm.
yeah, this year. All right, so now,
because once you get that desired result, it's good for 3 years.
exactly, so once we get you to the volume we want,
Mhm.
so obviously you're gonna look really swollen and everything now, but I still wanna show you what everything looks like, just so you
Okay.
can see an idea of where we're going. Vellatero is unique, it forms little white bumps almost, like white discoloration for a few hours and then it settles in.
Mhm.
But the goal long term, go ahead and take a look, you have the, obviously it's gonna be swollen and everything. But the
Wow.
goal long term would give you some support, improvement here, lifting back there. Now, if you can notice, look at the chin, look at the lips,
Mhm.
and then the fine wrinkles.
This side is a little bit more. cut.
Yeah, I also think it's the Sculptra. A lot of that's
Okay.
the Sculptra and the injections. It'll all go down.
Because I know, remember, last time you saw me,
Mhm.
you wanted to do more on this side, because,
I actually did more on that
okay,
side.
cool,
I did.
okay.
And then I also, just for long term, so you have a slender jaw. But what do you think of like the projection of the chin?
That looks good,
What do you think of the lip?
that looks good.
Yeah. So I think the rest is all from pokes and swelling.
Mhm.
But I'm happy with what I know it's gonna be. You know, once all the Sculptra settles down, that's the key. I always tell people it's hard to tell with Sculptra because a lot of fluid goes in there and you're also numb, so it changes things. You gotta give that a few weeks and then
Is there any
that's
way,
it.
you can't lift that a little bit right there?
I would wait a little bit because we already put some in there.
Mm.
Let it settle and then let's
Oh,
see.
okay.
But there's
Well,
also, if you see like right here, all these little bumps, that's the
Oh,
filler. That's the
okay.
filler in there that's gonna settle.
My lips are, they were always uneven.
Naturally, but yeah, it's so much better though.
Yeah, well, see, when he did the fat grafting, because he kind of went with the natural flow.
Yeah,
So it
then they
still
want
went,
more side,
so,
yeah.
yeah.
So this is a nice improvement to start. This is the start of our building process, guys. Bye.